So why do business planning? Well, here are some very common reasons. Well, I have to learn to be more efficient. I've seen so many good programs fail when the grant runs out. Budget pressures keeps increasing. I need to generate revenue. I need to speak the language with business people and my own business manager. And one of the funders is requiring a business plan at the end of our funding cycle. And nowadays, even nonprofit organizations are required to determine where's the return on investment of this program to funders. And funders want to make sure, like, should we invest our funds to your organization versus this other organization that also has the same needs, who's also reaching out to the same community members, but we want to make sure that we're investing. The funders are thinking we want to invest in an organization that's going to give us a greater benefits for our $1 that we're going to invest in. So this is why business planning is so important, because if you want to make sure that your public health issue is being addressed, you need to show what is the return on investment to these funders and investors. All right, now I hopefully convinced you why a business plan is so important for public health professionals as they're driving their mission. So what is a business plan? Well, it is a document with a purpose of launching a new venture. Now you're thinking, well, I'm not really selling, or I'm not really having any products, but hopefully by now you know that you are selling your public health issue. You want to have buy-in for people to make positive change, for social change. So these are ventures. Think of it that way. A business plan should answer these following questions. The first one is, what is this new venture? Well, what is this new program, this service, or this new public health campaign that you want to share with your community? And is there a need? Remember, in community health sciences courses, you probably learned what is a need assessment. So this is something you might want to do before you launch into this venture. And is there a revenue stream? And will that revenue stream last? You know that you're thinking, well, we don't really make profits, right, as a nonprofit organization. Well, think of profit as a surplus that's generated from these programs that you're offering, or the extra funds that the fundraising allotted, or your investors who could be just donating to your cause. So these could be things to think about in terms of their profits, but they're really surplus to help your organization run more smoothly. So in summary, the profit in public health is very different. So instead of thinking money in and money out, think of money in and mission out. So that business planning makes it easier to get money and to turn the money into energy, which can generate the outcome that you want to achieve based on your logic model. So what are some issues to overcome? Well, you want to think about what are some of the revenue issues that can come up. And what about the time constraints, and is it feasible? And what about the lack of business experience? What's the differences between grants versus business planning? And is business planning really appropriate for all types of projects or only for certain types? And what's the language between business and public health organization that we might want to be aware as we are approaching business planning? Business planning, yes or no? You might want to ask yourself these questions to help guide the business planning approach. Do you offer wellness services to local businesses? Yes, assuming you charge for the service. Do you create a master budget for the public health agency? No, this does not involve revenue. What about expanding the flu shot across low income service workers? Maybe if you're offering it for free, or you're going to charge some type of administration fee for it. And what about establishing an advisory committee to help with the business strategy planning for public health? No, this is just a strategy. You're not actually generating any revenue. So what are the steps in a business plan? Well, there's about 1,000+ different business plan books out there. And we decided to just give you a big overview of what are the main components of a business plan that's most relevant to a public health organization. So here we outlined these specific characteristics. And we are going to go over these in detail in a bit, but I just want you to understand that business planning can be applied applied in many different organizations, and for different specific products and services within an organization. So in order to make this business planning a little bit more relevant, let's revisit the case that we were talking about in the very beginning. So in this particular business case scenario, we're going to look at how to address the issue on asthma. So in this scenario, the survey uncovered there's an alarming prevalence of asthma among children, prompting the health department staff to search for evidence-based interventions that could be used to address this problem. The proposed interventions involves trained personnel making one or more home visits to conduct activities within the home. And these activities focus on reducing exposure to certain types of asthma triggers, environmental assessments, education, any way to reduce the asthma triggers in a home environment. And this program was well received. And now they're preparing a proposal to be considered so they can expand this or either to apply it to different community. And so therefore, it is important to develop a business plan based on the information that was derived from this small case study here, right? Well, just they looked at, okay, we looked at our community, we had a couple nurses go out to visits, and did we see any improved outcome? And with this information, you could then do a SWOT analysis, which you're supposed to do in the beginning of this module, and they could do this to a SWOT analysis, and then with the information they can then have the data to write up their business plan. And the reason why we're going to show this as an example is that you're going to revisit the strategic issues that you came up with in the very first half of this module, which is from your SWOT analysis, and you're going to pick one of those issues to focus a business plan. So in this example, we've already just picked an example, which is the asthma issue, to design a business plan on a program. In this scenario, it's a proposed intervention to address asthma. So you're going to do a similar case study and using the tool of business planning that was derived from the list of what we've just been talking about to address a specific issue. And we're keeping this vague and open so that we welcome all different ideas from your teams to design what could be interventions or programs or services that your organization wants to address based on the strategic issue that you decide to focus on. So in this case, it is an asthma intervention, and the evaluation plan is based on a logic model, which we went over in week 7, where you design what were some of the inputs, right? Where the staffing, funding, partners, and time and materials. And from these inputs, which are the resources, what are outputs that could be derived, and what are the outcome measures in terms of short, middle, and long term that you anticipate that's going to be achieved once these activities are met to drive these outcomes and outputs, right? So what are some of the questions that you want to ask? So for in this case, we want to ask the question, were the numbers of staff and amount of time sufficient, right? And was the community partner effective and successful? And the indicators what are very important in terms of measurements and matrix is the number of staff, money that was used, and the numbers of partners and amount of time. And then you, of course, you go across and you analyze the information that was gathered. And now with this information, you can derive what would be a business plan that will be focused on the intervention that you proposed in this particular scenario. All right, so are you ready to develop your business plan now? So here, we're going to use the Rhododendron County Department case study again, and this time it's going to serve as a basis for developing a skeleton business plan for your local health department as it adapts to the challenges facing the local health department in the early 21st century. So assume your team is directed to draft a specific business plan for a specific public health intervention addressing a community health need identified in the case study, incorporating the 7 business plan components that the health department can submit as a supportive documentation for a funding proposal. So the purpose of our tool workshop, the business plan tool that you're going to develop here and learn, will focus on the following business plan components. First is marketing plan. Second is the business concept, the milestone, the financial analysis, operational plan, risk and competitive analysis, and market analysis. There's a lot of resources that's already posted on the Blackboard site to give you some background on how to write a business plan. Also, examples, articles describing successful use of business health, a business plan for public health. As well. So I'm going to go over some of the purposes of each of these components, and so give you some ideas for your group to consider as you guys are working on your business plan. Okay, first is the executive summary. This is a very important paragraph, which is it gives the first impression, and it's usually in the very beginning of a document. So even though it is in the beginning of the document, I always save this part last because you don't know what to summarize yet until you figure out the whole entire plan. So save this part, the executive summary, the last step, the last part of your plan, right? Because then by then you have your whole plan written up, and then you can summarize what you want to drive at. But most people read the beginning and the end of a document. So that's why the executive summary is so important to be in the front. This table describes a typical business plan format. It first starts with a title and cover page, an executive summary, a business concept, marketing, analysis, financial analysis, the risk and competitive analysis, operational plan, marketing plan, and milestones. For the purpose of our course, which is focused on public health management, we will rearrange these components so that it fits the needs and the stakeholders' perspective. Therefore, we're going to start with the marketing plan, then the business concept, then the milestones, then the financial analysis, then the operational plan, then the risk and competitive analysis, and then the market analysis, and end with the operational plan again. Depending on which industry that you decide to work in or to consult with, it is very important to look at what is a typical business plan in that organization or with that industry, because using these same components, it could be rearranged in a different way. Maybe for another organization, the financial analysis is very critical into their business plan, so they may put that as the first component of their business plan. Whereas here in our public health example, we're using the marketing plan as the first component of our business plan format. In any case, most business plans do cover these components. They may be named a little bit differently, but they all cover the same ideas. So let's dive more into the business plan. So first is the marketing plan. Its goal is to describe the strategy to reach the target audience through branding, through distribution, pricing, and promotion. So in the case of public health organizations, you want to think about who is the community that you want to connect with. What type of branding is most accessible to them and that is attracted to them? What is the distribution channel? Do they read the newspaper, or are they always on their phone, or do they use the internet a lot and that's only through the computer? And what's the price range that's reasonable for your community? If it's in a low income, vulnerable population, maybe having a low pricing seems to make more sense. And who is going to help promote this? Would you get students to help promote this, or engage with local leaders through churches, through religious platform, or with other organizations that are already well knitted into the community? So this is why a business plan in this particular case focuses on a marketing plan first, because it's really about connecting to the community. And using the logic model, the activities is where the business plan will come up, and the information from the activities from the logic model will feed into the marketing plan. And some of the theories behind this is based on service utilization, planning, social marketing, and participatory research. The second part is the business concept. It is to describe the program design with goal and objectives. It is important to keep in mind that the goals are SMART. And what I mean by SMART is to make sure that specific, measurable, attainable, realistic, and time. And that these SMART goals aligned with the organization's mission. And the theory behind this is the entire program theory. And where does it fit in the logic model? It's actually the entire logic model should be aligned with the business concept. The third component is the milestones, or you could think of it as the steps in between whether the goals are being met or not. So this gives time frame for accomplishments of key tasks and outcomes. And the theory behind this is the process and outcome objectives. And where this fit into the logic model element is the immediate and long-term outcomes. By analyzing where your immediate and long-term outcomes, you can kind of plan backwards where you should be focusing your energies, resources from a day-to-day, month-to-month, quarterly time frame to meet those milestones. The fourth phase is the financial analysis. And the goal here is to project the revenue and the expense and the fiscal assumptions used in analysis. I know you're thinking, well, we don't really make any money or profits. Again, think of it as surplus. I like that word surplus because it's such as a positive tone to it, right? Instead of thinking like money and profit. So think of it how to project surplus into your nonprofit organization. In this case, it's a public health department. And the process theory element is the organizational plan, inputs, monetary resources, and budgets. The fifth thing is the operational plan, which is the meat of the organization. How is it being run? It's to show the personnel, management, space, equipment that come together to make this program run efficiently and effectively. And the theory behind this is the organizational plan, inputs, human, informational, physical, managerial, time, resources, and transportation. And where this fits into the logic model is the inputs and activities. So once a lot of the information that you're going to use for your business plan is actually really derived from your logic model. So, if you have a very well written logic model, half the plan is already written almost. So the last was the last part, but the fifth one is the risk and competitive analysis. This is to disclose the sources and the types of possible failures with alternative to avoid those failures, balance the failure risk with the merit of the program. So you remember we did a SWOT analysis? What were some of the external forces? Do you guys remember? Yes, it was the opportunities and threats. If you did your SWOT analysis very effective and really with detail, you should be able to identify what those threats could be. And because by identifying those threats, you minimize the rate or the possibility of failure. So this is a great way to how to kind of align all the different skill sets that you're learning, which is the logic modeling, the SWOT analysis, and how they all come together into helping you design a more effective business plan. The other issue is now after the risk and competitive analysis is looking into the market analysis. Now, you did your marketing plan. Now it looks like the market analysis. And in this case, you're analyzing the demand, the need, the competition, and the effect on the existing services and health status. So, once you did your marketing plan, which is like how to actually, sell your idea or sell your program, your services, is to look at, well, if you could be doing a great marketing campaign, but if there's no need, or if the audience aren't really accepting your proposal, or they're not really understanding what the whole entire public health campaign is about, you might want to relook at the market analysis, is to examine, is there a demand for this issue to be addressed? Or is there a competition? Is there another group or another organization that's addressing this public health issue much more effectively than you are? And then maybe you want to readjust what your organization is putting out there so it uses its resources in a more effective way. So the market analysis is actually very important in your organization to make sure that it is analyzing the demand so that it's meeting its resources to the need of the community that you're serving. The last part is operational plan. And this is really just to end with to making sure that, you align the business concept, the market analysis, the financial analysis, the risk and competitive analysis, the marketing plan, and the milestones are all really coming together to make this operational. So usually this last paragraph is really focusing on putting it all together. And you can also, this is the eighth one. So in this case, we're only requiring you to do 7. So you can decide if you want to have a concluding paragraph that concludes this again, or you can just really focus on the 7 components, which ends your business plan with the market analysis. At the end of this business plan, you want to end it with like a positive note or some type of mantra or some way to think about how your business plan is really coming together to meet this public health mission or this issue that your community is really passionate about. Because that way, it gives your business plan some context to why this is important, why we should even have this business or this nonprofit to exist to serve in our community. This last slide is to show you some of the other components of a business plan that you may want to consider adding to your plan for this assignment. Or if you think about these different components, if you were to use a business plan in your workplace, or if you were to get into a job that requires you to business plan, these are other components of the plan that you might want to consider. We're not expecting you to address all these different components, otherwise this would be like a 100-page business plan. But this is important for you to consider, and just to be mindful that there's a lot of different components of a business plan, and that a business plan is really industry driven. So you want to look at how a business plan written for that specific industry or for that specific service or that product or for that business health campaign. And so you align your business plan with what is typically the business plan for that field. And this slide is to really just show you that the business plan can really grow and be really specific to the nitty details, specifically looking at different components within the components then. So in summary, the individual tool is that after all the groups have posted their bulletin posts for their assigned components, each student will develop an executive summary of the comprehensive business plan as it's developed by the 18th and add to it to their toolkit. The suggested word length is 300 to 400 words, and each student will submit his or her business plan executive summary in this week's tool by the week 11 tool summary feature. Well, I look forward in seeing all your toolkits and see you on Blackboard.